When most people turn 65 and get ready for Medicare, one of the biggest questions that comes up again and again is this: how much money will I still have to pay out of my own pocket for healthcare, even after Medicare? People assume Medicare is free. And I get it, who wouldn't want that? You worked your whole life, paid into the system, and now you're ready to relax, retire, and let Medicare take care of the doctor bills. But the truth is, Medicare isn't totally free. It has a lot of moving parts, and the way you set up your Medicare plan, the choices you make, and even the state you live in, all of those things play a huge role in how much you pay every single year. Before we go into all of that, do me a quick favor, and this is something I ask in every video because I love seeing where you're all watching from. Go ahead right now and comment your name and state down below. I want to see exactly who's out there, who's watching this, and what state you're dealing with Medicare in. Because believe me, it's not the same for everyone. I also want to know who's actually using this information, because if these videos are helping you save money, make smarter decisions, or avoid big surprises with your Medicare bills, I want to keep making more like this. Alright, let's get into it. Most people only find out how unpredictable Medicare costs can be when they get their first bill. They sign up for Part B, they're like, okay, $174 a month, fine, I can deal with that. Then they go to the doctor, and boom, a $200 bill comes in the mail. Or they pick up a prescription and instead of the usual $10, suddenly it's $135. Or they spend a few days in the hospital and a bill shows up for $1,600. That's when people start asking the big question: wait, I thought Medicare was supposed to cover this? Why am I paying so much out of pocket? And that question becomes even more important every single year, because healthcare costs rise faster than regular inflation, and Medicare plans change every year, especially around prescription costs, deductibles, dental and vision, and even out-of-pocket limits. But here's the truth most people don't hear. You can lower your out-of-pocket costs, but only if you understand how Medicare works, how each part affects what you pay, and what costs you can actually control. That's what we're breaking down in this video. So let's start with the basics, because this will set the foundation for everything else. Medicare has 4 main parts: Part A, Part B, Part C, and Part D. And each one of those parts affects your out-of-pocket costs in a different way. Part A is your hospital coverage. It's the one that helps pay when you're admitted to a hospital, or if you need skilled nursing care, hospice care, or even some home health services. Now, most people don't pay a monthly premium for Part A because you paid for it through payroll taxes during your working years. So far, that sounds good. But the part they don't tell you? Part A has a deductible. And not a small deductible either. In 2026, that deductible is over $1,700 per benefit period, not per year, but per benefit period. That means if you go into the hospital in January and get out in February, and then go back in again in June, that's 2 separate deductibles. So even though Part A has no monthly premium, it's still going to take money out of your pocket if you're hospitalized. And most retirees don't find this out until they get hit with a bill, and that bill doesn't care if you're on a fixed income or living off Social Security alone. Now let's move to Part B. This is the part that covers doctor visits, outpatient services, lab tests, durable medical equipment, and preventive care. And this is where most people start to feel the monthly bite. Part B has a premium, and that premium is automatically taken out of your Social Security check every month if you're receiving benefits. In 2026, the standard Part B premium is expected to be around $185 a month or higher, but that's not the same for everyone. If your income is above a certain amount, you're hit with something called an IRMAA, an income-related monthly adjustment amount, and suddenly that $185 jumps to $230, or $350, or even $500 a month. And for some people, that's not something they planned for. Now here's the important part: it doesn't matter what plan you choose later. You have to pay your Part B premium. Whether you're on original Medicare, a Medicare supplement, or a Medicare Advantage plan, that premium is coming out of your check, and that's the foundation of your medical costs. But we're not done. Part B also has a yearly deductible, and in 2026 that deductible is expected to be $250 or higher. Now here's where most people get frustrated. Even after you meet that deductible, Medicare doesn't cover 100% of everything. It covers 80%, and you're left paying the remaining 20% unless you have additional coverage. That 20% might not sound like a big deal, until you're dealing with things like cancer treatment, physical therapy, outpatient surgery, or ongoing specialist visits. If your treatment costs $20,000, guess how much 20% is? That's $4,000, out of your pocket. And to make things even more complicated, there is no out-of-pocket maximum with Original Medicare. Which means if you're on Original Medicare and you don't have a Medicare Supplement or Advantage plan, there's literally no limit to what you can pay in a year. Your medical bills can just keep adding up, and there's nothing in place to stop it. But that's where Part C and Part D start to come into play, and this is where people start making choices trying to protect themselves financially. Because once people start realizing what Medicare doesn't cover, they start looking for something that helps put a limit on those out-of-pocket costs. And that's where Medicare Advantage plans and Medicare Supplement plans come in. Medicare Supplement plans, or Medigap plans, are insurance policies that work alongside Original Medicare. They help cover things like that 20% Medicare doesn't pay, or the Part A deductible, or excess charges. For example, if you have a Medigap Plan G, Medicare pays its 80%, your supplement pays the 20%, and you're protected from those big out-of-pocket surprises. But nothing is free, and a Medicare supplement comes with a monthly premium. And that premium depends on your age, your state, the insurance company, and even your health when you enroll. So one person might pay $125 a month for Plan G, while someone else pays $260 a month for the same exact coverage, just because they signed up 5 years later or live in a more expensive state like New York or Florida. But for some people, that monthly premium is worth it, because it gives them something Original Medicare doesn't: peace of mind. They know if something happens, they're covered. No co-pays, no co-insurance, no bills piling up. But then there's the other option, Medicare Advantage, also called Part C. These are all-in-one plans, where a private insurance company takes over your Medicare benefits. You still have Part A and Part B, but now the insurance company manages the costs. And here's the part that gets people interested: many Medicare Advantage plans have $0 monthly premiums. That means instead of paying $200 or more per month for a supplement, you pay nothing extra, and in return, you get an out-of-pocket maximum. That out-of-pocket maximum is what protects you. It means that no matter how many doctor visits or surgeries or treatments you have in a year, you cannot pay more than that number. And in 2026, that maximum is around $8,300 for in-network services, depending on the plan. Now some people hear that and say, wow, I'd rather have an $8,000 limit than no limit at all with Original Medicare. But other people say, no way, I'm not paying $8,000 in a year, I want full coverage up front even if it costs me more per month. And there's no right or wrong answer here, it all depends on your health, your income, and what kind of risk you're willing to take. Now let's talk prescriptions, because this is one of the things that hits the hardest when it comes to out-of-pocket costs. Medicare Part D is your prescription drug plan. And if you're on Original Medicare and you don't have a Medicare Advantage plan that includes drug coverage, you need a standalone Part D plan. And those plans have monthly premiums too, and the premium depends on the drugs you take, the pharmacy you use, and the plan you choose. But here's the part people don't realize until they go to pick up their meds: Part D plans change every year. The formularies change. The drug tiers change. The copays change. Something that was $10 this year could be $85 next year unless you change plans. And even if you're on the right plan, you still have something called the donut hole, where after you and your plan spend a certain amount of money on prescriptions, your costs go up temporarily. A lot of people don't even know this exists until it happens to them. Let me give you a real example. I spoke with a woman named Susan from Ohio. She was taking a medication that cost her $45 a month on her drug plan at the beginning of the year. She budgeted for that. Then in September, she got a bill for $165. Same drug, same pharmacy, same plan. What happened? She hit the coverage gap, the donut hole. And she had no idea that was possible because no one explained it to her. Now, the donut hole has been reduced a lot over the years, but it still exists. And if you're taking expensive medications, things like insulin, cancer drugs, or certain injectables, you will feel it unless you're on the right plan. Now let's talk about the emotional side of all this, because Medicare isn't just paperwork. It's not just numbers. This is about your health, your future, and your bank account, all at the same time. I've talked to people who say they feel like Medicare is supposed to make life easier, but instead, they're more confused, more overwhelmed, and more worried about money than ever before. And here's the truth, out-of-pocket medical costs are one of the biggest financial fears for retirees. Not running out of food, not running out of housing, running out of money because of medical bills. And when you're 70, 75, or 80, you're not going back to work to make up the difference. The money you lose is gone forever. And that's why understanding how Medicare affects your out-of-pocket costs is so important, because once you learn the rules, you can make choices that protect you. You can choose a plan that covers what you need. You can avoid plans that have giant copays and high drug tiers. You can switch to a plan that includes dental, vision, hearing, and over-the-counter benefits. And guess what? Most people don't even know they can switch plans every year during the annual enrollment period. Or even outside of it if they qualify. Let's go back to something important. Medicare costs are not the same for everyone. If you're really healthy, don't go to the doctor much, and only take a couple generic prescriptions, a $0 premium Medicare Advantage plan might save you the most money. But if you're battling cancer, or on dialysis, or seeing multiple specialists every month, a Medicare supplement might save you tens of thousands in out-of-pocket costs over time. And that's why it's rarely a one-size-fits-all solution. The best plan for someone in Florida is not necessarily the best plan for someone in Kansas. The best plan for a 65-year-old might be a terrible plan for a 78-year-old. Your health changes, your needs change, your prescriptions change, and so does your Medicare plan. That's why the biggest mistake people make is this: they sign up for a plan once at age 65, and then they never review it again. Meanwhile, the plan changes, the premiums change, the network changes, and the out-of-pocket costs go up every year, and the person is sitting there thinking, why am I paying so much? I thought this plan was supposed to help me. But they haven't looked at anything since 2018. The people who pay the least out-of-pocket every year are the ones who check their coverage regularly. They compare plans. They review their prescriptions. They ask for help. And they stay educated. And here's the good news: it doesn't take a college degree to understand Medicare. You don't have to be an insurance agent. All you really need is someone to break things down for you in plain language, and that's exactly what I try to do in these videos. But let's go deeper for a second, because there's one more thing most people don't hear about until it's too late: lifetime penalties. If you don't sign up for Medicare Part B or Part D when you're first eligible, and you don't have other creditable coverage, Medicare will charge you a penalty. And it's not a one-time penalty, it's a lifetime penalty, added to your premium every single month, forever. And again, people don't even hear about this until they're already in trouble. I'll tell you a story. I spoke with a man in Nevada who didn't enroll in Part D when he turned 65. He said, "I'm healthy, I don't take any medications, I don't need it." 8 years later he was diagnosed with Parkinson's and suddenly had a stack of prescriptions. He finally signed up for a drug plan, and Medicare slapped him with a penalty of $45 a month on top of his premium, every month, for the rest of his life. And all he said was, "Nobody told me." And that's the real tragedy. The people who need Medicare the most often don't understand it until it hurts them. That's why we do these videos. Because the more you know, the less you'll pay. The more you understand, the less stress and surprise you'll deal with later. And if you're watching this right now and you're feeling overwhelmed, like all of this is too much, don't worry. You're not alone. And you don't have to do this by yourself. There are free resources. There are experts who will check your prescriptions, compare your plans, and review your costs every year, all at no charge. And you can avoid the biggest Medicare mistakes just by asking the right questions. Is my plan the lowest cost for the medications I take? Does my plan include dental and vision benefits? Am I paying too much in premiums? Would a Medicare Advantage plan save me money this year? Would a supplement plan save me money in the long run? Am I paying for benefits I'm not even using? Every single one of those questions is tied to your out-of-pocket costs. And every dollar you don't spend on healthcare is a dollar you get to keep in your pocket. Now let me tell you something that may surprise you. When you're on Medicare, the average person pays between $4,000 and $7,000 per year on healthcare costs. And that's the average. If you're diabetic, or have COPD, or have cancer, or need dialysis, that number can double. If you're taking 3 or more brand-name drugs, it can triple. If you don't review your plan every year, it can skyrocket. But the people who review their coverage, choose smart plans, and use all their benefits, they pay less. Sometimes thousands less. And there's nothing lucky about it. They were just informed. And they took action. So if you're watching this right now, here's what I want you to remember. Medicare doesn't control your out-of-pocket costs, you do. Based on the decisions you make. Based on the plans you choose. Based on whether you stay informed or not. Now, if this video opened your eyes in any way, if it made you think twice, or helped you understand something you didn't know before, do me a huge favor and hit that like button. It really helps this video get shown to more people who need it. And don't forget, if you haven't already, comment your name and state below. I want to see who's here, what state you're from, and how many of you are out there getting real Medicare education for free. And if you want more videos just like this one, about Medicare plans, how to save money, new benefits, upcoming changes, cost comparisons, and more, go ahead and subscribe and turn on notifications. We put out new videos every week to help you stay protected, stay informed, and stay ahead of the changes. Because Medicare is almost never the same 2 years in a row. And the people who win are the ones who stay up to date. Thanks for watching, and I'll see you in the next video.